All right, thank you for joining us today. Today we're joined by Gerard Greene. Gerard is a pelvic health physiotherapist specialist from the UK. He has 3 clinics that specialize in female and male pelvic pain, and they help patients from all over the UK. However, during COVID, he has developed a busy online pelvic health clinic to support patients not only from his local community, as well as patients abroad all over the world. Gerard is passionate about helping people with pelvic floor dysfunction, and he is also heavily involved in the training of other physiotherapists in this specialized area of practice. He met us and the entire Desert Harvest team at the American Physical Therapy Association conference in Denver earlier this year, and where he was both teaching and presenting. And he shares our passion here at Desert Harvest for helping patients who are having a very difficult time, especially with pelvic pain. Thank you, Gerard, for joining us and taking time out of your busy day to talk to our audience.
Yeah, thanks, Heather. It's a real honor to be invited by you and the Desert Harvest team. And I suppose people will have been wondering how a pelvic pain physiotherapist from the UK ends up on the USA Desert Harvest Facebook Live. And it was really great to meet you and the team at the American Physical Therapy Conference in Denver. And I think, as you've said, I think what I really got from meeting you and Bernadette and your colleagues is that you guys share a real passion for patients with pelvic health dysfunction, especially pelvic pain. And, I think that passion kind of flows through the work that you guys do, which obviously I share also.
Thank you. Thank you. Well, let's jump into it. So you mentioned, we'd mentioned above that you're starting to do telehealth for your pelvic patients worldwide. Why don't you tell us a little bit about how you're operating, how you're seeing patients now these days with COVID?
Yeah, so I think before COVID-19 hit us, and now I think here in the UK we're probably into week 11. So prior to that, most of our pelvic pain patients came and saw us in the clinic, but we would all of us have had maybe a small number we would have seen online, but really very few. So then COVID-19 hit us probably towards mid-March, and we made quite a quick decision that, we had all these patients that we needed to help. And, we had lots of new patients who wanted to see us. So we decided that we would really extend our online provision and offer that to all of our patients. And I think we didn't really expect that it would be so popular, in that apart from looking after our kind of patients of our local communities and patients from the UK, we've actually had quite a few patients from abroad contact us. And both myself and some of my colleagues have seen patients. So we've seen patients from Barcelona, a couple from the States, we've seen a couple from Norway, Denmark, Germany, Ireland. So it's kind of really extended our reach, because I think, you and I have spoken about this before, is that both females with pelvic pain and kind of men with pelvic pain, they do find it quite hard to find kind of good quality information online. They find it hard to find physios who'll see them. And I think now people, because everyone is Zooming with their relatives or their kids or work, I think people are happier kind of maybe doing that Zoom type appointment. So I think for us, we've learned a lot from it, and we kind of do all those appointments via Zoom. And it works really well, because I think people are at ease because they're in their own house, as long as that's a safe, comfortable place to be. So people are kind of at ease in their own house. They don't have to travel too far. And I think what I like to say is, like, no one's ever late for a Zoom appointment at the minute, because at the minute, people aren't doing too much, because everyone's kind of working from home, so they're not kind of navigating traffic or kind of trains, buses, etc. So I think for us, it's been brilliant, really, and we feel, both myself and my colleagues, that we're kind of doing a lot to help lots of women with pelvic pain, lots of men with pelvic pain at this really challenging time.
That is true. So for a lot of these, this is introductory to, physiotherapy for pelvic pain. Is pelvic, a lot of us grin and bear our pain, but is pelvic pain normal?
Well, I think a phrase I really like is that, so pelvic pain is common, but it's definitely not normal. And I think frustratingly, when a lot of women go to see their physician or GYN specialist, they may be told, well, you've got to put up with this. We've done all the tests, we've done all the urological tests, we've done all the gynae investigations, we've done the colorectal test, section. We haven't really found too much wrong, so you just need to get on. But we know that's not right. In that, so pelvic pain, it is common. Probably maybe it affects maybe 1 in 7 females, probably a similar amount of males, although the men are even worse about getting help for it. But it is definitely not normal. And I think one thing that might be interesting to tell your listeners is how do they know if they have pelvic pain? And because I think sometimes women will probably put up with too much, especially if they've got other things going on in their life. They tend to maybe put themselves last. They put maybe their partner, children, family, relatives first. Uh, and so pelvic pain is really where, if we maybe do female pelvic pain first, so women are getting kind of pain around that kind of lower abdominal area, that kind of pubic area at the front, that kind of vulval clitoral area. They may be getting some internal vaginal pain. They may be getting pain in that kind of soft area underneath, kind of between the kind of vulva and at the front, rectum at the back. They may be getting kind of pain around the rectum back. So they're getting pain in those areas. They can also get changes in sensation, where it feels maybe very sensitive to touch. It might be really sensitive to have kind of tight fitting underwear or kind of jeans or denim. It might be sensitive to sit, particularly on a hard surface. And so there might be increased sensitivity, but also some women feel almost a bit of a disconnect with that area, that maybe they've lost some sensation. So the sensation can vary, but pain tends to be a big factor. And then the other things that tells us that there is pelvic pain is that kind of going to the restroom might be painful, such as kind of passing urine might be painful, uh, doing a bowel movement might be painful. Uh, uh, there may be pain on intimacy, so that's either self-intimacy, intimacy with a partner, and really kind of lots of kind of bowel symptoms, urinary symptoms, sexual health symptoms, lots of pain. And I think if there are people with pelvic pain kind of listening to this or watching this, they're probably not very comfortable sitting there. So they might have to kind of move, or they might be standing, or when they go to meetings at work, or especially at the minute where everyone's kind of home working, they might have to have a cushion, or they might be having more symptoms out because of that sitting.
Okay.
And then with the guys, because I think people often forget about that, the guys get this as well. So I think it's really nice, Heather, that you've asked me to include the male pelvic pain. That's where guys get pain around that kind of lower abdomen as well, some scrotal pain, some penile pain, kind of pain in that perineum underneath, rectal pain. But the big thing the men get is that they get lots of post-ejaculatory pain.
Mhm.
They get pain on sexual activity, and also get some erectile dysfunction. So I think both for females with pelvic pain, it's quite an awful condition, and you will know that because I know you've it's very close to your heart with family members, and I know Ileana, who's our mutual friend, who designed the EZ Magic, who designed the EZ to Cool, the kind of ice packs for pelvic pain, and I know she has talked a lot about really the really debilitating impact of this condition.
Oh yeah, I've experienced it myself. I had my first child at 20, and I'm
Right.
41 now. So I feel like I've been dealing with it in some way or another for a long time. It's definitely for women in regards to childbirth and everything else like that. We definitely put some strain and stress down there in that
Yeah.
area. So what can a pelvic floor physiotherapist do for pelvic pain via telehealth? How does that all function?
Well, I think Heather, what I really liked, whether you came up with it or whether one of your brilliant Desert Health colleagues came up, I really liked the phrase kind of PT for pelvic health for pelvic pain at home. I really liked that because I think that highlighted uh, that at this really difficult time that help is still out there. And there are amazing pelvic health PTs in the States all over, and a lot of them will be. Some of them will be back in their offices working, but a lot will still be offering telehealth. So what do we do? I think probably that one of the big things we do is try and work out, well, what is going on with that woman or that guy with pelvic pain. So we do a lot of questionings as to, well, what symptoms are you getting? So, if it was you, Heather, I'd say, well, Heather, what symptoms are you getting? Where are you getting pain? Then we
Mhm,
would ask a lot about urinary function, bowel. Uh, are there any kind of symptoms on intimacy? So we get a real picture of kind of what's going on symptom wise. I
okay.
think the other thing that we as physical therapists have a lot of skill at is really trying to work out, well, how is it impacting you?
Mhm,
So, how is it affecting you doing your job or occupation?
mhm,
Have you had to change kind of the activities you like, maybe the hobbies that you do? How is it affecting kind of your function at home, kind of relationships, and also really kind of getting down to, well, what impact is it having on you as a person in terms of what stress is it creating, what anxiety, what changes in mood? So and then we can kind of work out from that. Well, are you kind of getting pelvic pain? What's driving that? So a lot of these women will have had symptoms for a very long time. Although I think that's changing. I think through the work that you do and through the work that EZ Magic does, that there is definitely more awareness of pelvic pain. So I think people are maybe starting to get help a little bit sooner. In previous years, we would see men who've had symptoms for maybe 2, 3, 4, 5 years. Now we're seeing those much earlier, and that I think that is through the awareness on Instagram, kind of Facebook, people being able to find people on Google. So I think that's a real positive of the impact of social media on pelvic pain. What do we do in terms of management? I think I think probably a big thing that we do
mhm,
is really start to explain, well, what's going on. What's causing some of this pain?
mhm,
What's causing this sensitivity around that maybe genital area, maybe that abdominal area, that perineum? What's going on with those pelvic floor muscles? And I know people find that kind of difficult because you think, well, surely you need to maybe do an internal examination or you need to do maybe an ultrasound scan.
mhm,
But that is really, really useful in the ideal world where we can see everyone in clinic. But
mhm,
it's a bit like if you're very experienced at something and you've seen lots and lots and lots of patients, you can start to recognize patterns. So you can start to recognize, well, does someone have pelvic pain?
mhm,
Might they be having some symptoms of endometriosis? Might they be having like a pudendal nerve problem? Might they be getting some vulval? So you can from the things that they describe, you can kind of work out what's going on. And what I'll do then in a minute is maybe go through some of the key things that we can get patients to do, which starts them on that kind of journey to kind of improving their quality of life, getting rid of some of these symptoms, and basically getting back to real living.
Well, and I think, Melissa here, she's joined us. She's asked a question. She says she's worried about doing this at home herself. She's concerned that she's going to hurt herself, or she's concerned, and I've heard from a lot of other women that are concerned about the telehealth. Is this going to be a Zoom call where I become a porn star? How does this function in terms of are we doing treatment together? Are we, how is that functioning with the telehealth, as far as, is this is something that we're looking at those, and you're kind of guiding them over the phone, via telehealth? How is that functioning?
Yeah, so I think so. Hi, Melissa. Good to hear from you again. I think that's a really brilliant, powerful question, Melissa. And I suppose that because I think for all of us, moving online is quite new. So it's likely that several months ago we weren't kind of Zoom calling our relatives, or we weren't doing Zoom meetings with work, or we weren't, like here in the UK people do kind of Zoom catch-ups with their friends. So we weren't doing that 3 months ago.
Mm-hmm.
We also weren't doing a lot of physical therapy or pelvic health online. So I think people will have these kind of concerns, kind of wondering, well, what actually does it involve? So, and just to put people's minds at rest, so the appointment doesn't involve people undressing. The appointment doesn't involve people doing anything intimate or internal. What the appointment involves initially, so say if it was yourself or Melissa, it would be a lot of, so you'd be there maybe in your home office, or your, not sure what the American term for your front room is, maybe your dining room, your kind of room, your quiet room. So a lot of it is kind of asking a lot of questions, talking through what's going on. And then initially, what you start someone doing, which kind of leads nicely into what we do with these patients, it's starting to get people to do some maybe things to kind of relax that pelvic floor. So that may be things like Headspace, mindfulness, kind of bit of abdominal diaphragmatic belly breathing, little bit of reverse Kegels, which is a way of relaxing your pelvic floor. So that's very much exercise based. We would then get people doing things for their kind of lumbar spine, hips, really to try and get some movement in that.
Okay.
So that's very much exercise based, that we would kind of talk you through, then send you some nice videos of those. We also get people starting a lot of men and women with pelvic pain get really bad kind of abdominal tenderness, abdominal sensitivity. So we kind of go through with those people how to do some self abdominal massage.
Okay.
And then once people are doing that, we then maybe over a couple of sessions, maybe progress them to then doing some of the internal work. And
Okay.
that's where we might start to introduce maybe the EZ Magic Wand. What goes quite nicely with that is the Aloe Glide. That's a really brilliant kind of hypoallergenic natural kind of lubricating product, or the Revulum, which is the that kind of pain relieving product. But really, the internal work comes much later on. And
Gotcha.
really the internal work is not something that people will do as part of that early telehealth at all. And once we come, so kind of in my experience over the last 8 weeks, when we progress to doing the internal work, what we will do is probably be very selective of those, of which patients are going to do that. So that's the patients who have found that they can manage doing the exercises, they can manage doing maybe that kind of outdoor exercise we're going to get them doing, maybe like walking. They can manage the breathing, the abdominal work. And then what we would do is kind of talk them through how to very gently maybe start to do the EZ Magic. But they're doing this very, very gently.
Okay.
and we would kind of provide them with some kind of self-help video. That's where maybe some of Ileana's very esteemed American colleagues have done some really nice patient self-help videos, like Amy Stein from New York, Maria Elliott in the UK, myself for some of the men. But those are really those kind of experts talking through what those women are going to start do, or in my case, the men. So really, there's no undressing, there's no there's nothing kind of no intimate self-examination on that bit, and that's really important to put people's minds at rest.
Yeah. Okay, and so obviously with the rise of COVID, we have had a rise in stress and anxiety for a lot of people, and this is causing a lot of people to have an increase in their pelvic pain symptoms that they might have otherwise had managed. But besides, doing telehealth and PT, what other tips can you recommend to kind of manage that stress and that pain?
Yeah, I think because I was quite interested in this. So myself and a couple of colleagues, because we kind of went into some of the pelvic pain forums, most of which are on Facebook. So they're really good kind of self-help forums for both females with pelvic pain and males with pelvic pain. And we kind of did a little bit of work in asking them, well, how has COVID-19 affected your pelvic pain? And a bit like you've said there, Heather, things came back saying, well, the stress, anxiety have made things worse. I'm worried that I won't be able to have any of my appointments, either with my GYN, with my pain specialist, with my physical therapist, whoever. And then the other thing that's changed, because I suppose, unfortunately, the UK and America seem to be joined in having a really, really, really difficult time with COVID-19, in that people's activity levels have really plummeted, in that most of us are home working. So we're much more sedentary. We're working not in great kind of ergonomic situations. What can people do? I think what's really a couple of key points are that it's good to seek out some online help. It's good to use the products safely that are available. And I think one things that people can use, which I would strongly advocate, is the EZ2Cool is very good, which you guys provide. The
Yes.
Aloe Glide is really good, and the Relvium is very good as well. Because I'm from Ireland, I have a real problem with saying words, so you might need to pronounce that properly. It, so those products are really good. It's also good to, depending on what maybe state you're in, or where you're listening to this, we have some restrictions on our ability to go out, but it's important to try and get out and take that exercise. It's important to do some of the stuff to address some of that stress, anxiety, like Headspace, the breathing, doing something people enjoy. And I think also it's maybe a time where people are reflecting on maybe changes in their life, or doing things differently. And it may be a time for people to decide, well, I've got pelvic pain. Maybe it's time for me to seek out help for it. And that's because, there's lots of research that suggests that, people endure this, and they do endure, because it's an awful condition. They endure this for a very long time before kind of seeking help for it.
And I'll just let everybody know, since you mentioned it in there, Headspace is an app that is available both in the US and the UK. It's a meditation app. And there's a lot in there that has to do with breathing, other things. They have a lot of free content as well as paid content. So that's an app that's available on most people's phones. I highly recommend it. I use it myself. And then you'd also mentioned previously yoga. A couple of weeks ago, we did do a yoga for pelvic pain live event with a pelvic pain specialist out of San Francisco, Leslie Howard. So that's available our Facebook page and our YouTube page. Those are just a couple of different resources that are available out there. And then one thing that you mentioned that was really interesting, Gerard, is should people be doing Kegels and other pelvic floor strengthening exercises at home?
Yeah, so that's another really good question, and that's something that lots of people will come into the clinic, or now they'll have an online appointment, and a lot of people, because most people know that there is some type of pelvic floor component to this, and a lot of people might have been maybe not advised brilliantly, or they may have gone on Google. And so a Kegel is really a pelvic floor strengthening exercise. So, a lot of people maybe who've been through childbirth, who've had a baby, will maybe have some pelvic floor weakness, and they'll have been given Kegel exercises, or maybe people who've got some urinary symptoms will have been given Kegel exercise. But a Kegel is a strengthening exercise. Kegels tend to make pelvic pain much worse. So you'll see people, and like this yesterday, we had a new patient contact us, and she said that she had had a baby, but she'd kind of done too much Kegling for whatever reason. She'd really gone a bit maybe crazy with those Kegels, and that's kind of what brought on her symptoms. That's probably unusual, that we don't see too many like that, but what we do see a lot of people who have pelvic pain, they do lots of Kegel exercises, the Kegling makes them worse. Why does it make them worse? So there is a pelvic floor component to this, but it's generally that the pelvic floor becomes almost that it's working a bit too hard. The pelvic floor muscles become a bit too maybe contracted. If a muscle becomes too contracted, it gets a little bit ischemic, doesn't get enough blood in and out. That starts to generate pain. So it's a bit like, Heather, if I'm sure you're working very hard at the minute, if you're working at that computer for hours and hours, and those neck muscles go into spasm, they are going to get painful. And if they get painful, they might give you maybe pain up to your head or down to your shoulder. Whereas if the pelvic floor is working too hard, goes into spasm, that will give people both internal pain, particularly within that vagina. It almost feels very tight in there. It will give them a lot of pain, contraction around the kind of back passage,
Mm-hmm.
and that generates pain.
Mm-hmm.
So if that muscle's in spasm and that muscle is very sensitive just means that when it contracts, it's a bit uncomfortable. When it's maybe indirectly touches something, when there's maybe anything in the vagina, it's very painful. The perineum becomes painful. If people do lots of contractions and strengthening, it will make those symptoms worse. So what you try and get these women to do is to do more work, not to strengthen those muscles. So you kind of stop them doing the Kegel. You get them to do stuff that will really relax that area. So that's stuff like the abdominal massage is very good. Lots of belly breathing is good. And belly breathing is really, you get them maybe in line initially, one hand in the tummy, one hand in the kind of sternum or breastbone. You get them really nice, relaxed breathing into that tummy.
Mm-hmm.
Get them doing that in lying, building up to about 5, 10, 15 minutes. Then you get them doing that in other positions like standing and sitting. You can get people doing reverse Kegels. They're technically quite difficult to do. So doing them over a Facebook Live probably isn't ideal, but we can give it a go. What you get someone to do is you get them to take a really nice, beautiful big belly breath in, and then as they're breathing in, they very, very gently do a bit of downward pressure through that back passage or rectum, but very gently. So that's more like a sustained, gentle stretch to that area. But the main thing is the belly breathing. So I think to summarize that, Kegels for pelvic pain are not the best thing to do.
Mm-hmm.
It's better to really focus on more the relaxation stuff, and that's why that gentle yoga is very good for this also. And you asked at the start of this, well, what can telehealth do for pelvic pain? And sometimes that's one of the key things it does. You work out, well, what is this patient doing currently?
Mm-hmm.
Is that helping? Is that making things worse? and then you work that out, and you start them doing stuff that's both appropriate and helpful.
Okay. I know one of my most favorite things to kind of help ease some of the strain on the pelvic floor is I love the squatty potty.
Yeah, it's brilliant. Squatty potty. The unicorn is brilliant.
Yeah, I recommend that. Like, I think I bought one for Christmas for every family member I have. So let me.
And I think what's really good about the squatty potty is what we do with all our patients is, especially the men, because the men sometimes take a bit convincing, is we send them the YouTube unicorn video.
Mm.
And once people watch that, they go, actually, that's me. I now understand what you're saying.
That is a great video. I have shared that a couple of times, and I think that's available anywhere on YouTube or their website as well. So we talk about exercises, and I know you've mentioned a little bit some of these items, but why don't we show them some of the exercises and tools that they can be doing at home after developing a treatment plan with their PT. So you had mentioned the easy magic wands.
Yes. So I feel quite passionate about this because I've met Ileana. So Ileana Brockman is one of these quite amazing people who, and she says this quite publicly, that she has had, quite nasty pelvic pain. And she designed the EZ Magic, which is like the kind of curved, beautifully designed internal device, which I have loads of them here, but I do not have one within my reach. But there's lots of pictures on the website. And that's made of medical grade glass. So it's designed to a very high degree to be used internally. Probably generally in females it's used vaginally. In men it's obviously used rectally. And the EZ Magic is a beautiful device to do some really gentle internal work to really allow it to get to, and it works nicely with the Aloe Glide, to really start to get some nice mobility in those tissues. And a nice way to look at this is if someone had maybe some spasm in their calf muscle where they were out running or doing triathlon, they'd kind of think, well, what would probably help get rid of this tightness and spasm is to get some very gentle movement into those muscle fibers. And that's what the EZ Magic does. But the emphasis is really on really gentle internal mobility, getting a bit of movement of those tissues, those muscular tissues, and also getting them desensitized. So what does that mean? It just means that you reduce the sensitivity level, and that works really well. And usually you'll see someone face to face, and I think eventually we will, come to a time where that will become, where we'll get back to clinic. And I know a lot of clinics in the States have reopened, which is brilliant news for us in the UK. And there's also Ileana has put together some really nice resources online, which we can signpost people to. A lot of those are on YouTube, and that's some really amazing physical therapists, both from the USA, from here in the UK, really talking through how to use those for female pelvic pain and how to use those for male pelvic pain. The other thing that's really good, and we use this a lot, is the both the Aloe Glide and the Relevium.
There we go.
There are a couple. Sorry.
Oh, I'm holding it up so they can see it. The Glide. There we go.
There's one condition which is quite a distressing condition, where you can get, it's kind of called vaginal atrophy, and that tends to be quite common around kind of postmenopausal stages, where those kind of vaginal tissues lose some both kind of thickness, they lose kind of that moisture, they lose that lubrication. And for those women, it's really important that they use a really good quality hypoallergenic natural lubricant in addition to the other treatment they'd have. But that condition can also, that change in lubrication can also occur to some women postnatally as well. So that's really good also. And I think what it kind of reflects what we do in the clinic, in that when we see some of those male or female patients, on some of them, quite a lot, we will use the EZ Magic, or we'll show them how to use it. We will show them how to use it, send them off home with it, they'll use it themselves, and then they'll bring it back into clinic and we might treat them with it. So not every woman or male pelvic pain uses the one, but a good few do, but they all have to use that kind of hypoallergenic, kind of natural lubricant. And that also becomes very important in terms of maybe returning to intimacy, both to self-intimacy or with a partner. Because intimacy should never, ever be painful. If it's painful, that indicates that there is a problem there, and that's something that, rather than people putting up with it, which a lot of people sadly do, they need to kind of seek help for that.
And I'll kind of describe. So we are selling the IC Relief Easy Magic Wands this month, at least for a few more days through Pelvic Health Month. And so we do have, this is the standard size Easy Magic Wand that Gerard was discussing here, that's made of the medical grade glass. This isn't, when you drop this, you don't have to worry about chipping, but the greatest thing is that it's non-porous, like silicone and other, because it's easy to clean. It's, you don't have to worry about bacteria getting in those pores, and you can keep it sterile on a regular basis. It does come in a sterile packaging when it does arrive. And this is the larger size. We do have a larger size. This is good for men if they need to reach around, as well as for pregnant women that might need to reach further around a belly. And so we've got, this is the Easy Magic XL right here. And so we are selling both of those for Ileana for Pelvic Health Month. And then the Aloe Glide that he mentioned, this is right here, is 100% natural. It is pH balanced to mimic our natural vaginal pH of 4.5, but it's also isoosmolar, which is very important for a lubricant. You kind of want to be right around below 300 when you're talking, but not too low also for this. And isoosmolar means this is the water going in and out through your tissues. And if your epithelial cells are breaking down because you're using products that have chemicals in them, or because of postmenopausal, some severe atrophy, your epithelial cells, your vaginal wall is going to break down, which causes bacterial infections. This is gonna more prevalent STDs. This is your barrier, women. And so, isoosmolar lubricant is highly important because this is going to help rebalance your pH. Plus, this is 100% natural vaginal moisturizer. So we actually sell applicators that come in sterile packaging, can be filled up and can be used separate of sex to be inserted vaginally on a daily basis, just to help make those vaginal tissues healthy, help you make your own moisture, which is again is going to then in turn help with your pelvic floor work that you're going to do with your PT. And then sometimes the pain is so bad that like Gerard would need you might need a barrier to, there might be a pain barrier to treatment. And that is where the Relivium comes in, because this is all natural except for the 4% lidocaine. Aloe acts as a carrier for lidocaine to help it make it more systemic and long lasting. So the Relivium is going to be specific for helping with that barrier. And that also comes with a convenient applicator and sterile applicators as well. So Gerard, we also are also selling, and I'm sorry, we have had a rush and got completely sold out of IC Reliefs at Ellie's. She has these easy to cool pads, and we will have some more back in stock today. So currently I don't have one to show you, but the pads literally can insertable ice pack that you freeze, and you can just insert it in there, put it around your underwear and snap it in place. And so that if you are having pelvic pain or that type of thing down there, you can definitely use those ice pack pads. They're not going to move around and shift and be uncomfortable like other ice pads. They're meant specifically for your vaginal area, for your pelvic, or for your crotch area. So we also do have those available. I just don't have those to show right now.
And I think Heather, you made a really, really good point when you talked about both the EZ Magic and the AlloGlide and the Regular, is that those are designed for internal use. They're designed to a very, very high standard.
Mm-hmm.
And I think what people need to maybe to really almost kind of prioritize themselves and maybe think about, what products they're using on themselves, and particularly internally lubricants, because I think people would say that, people put a lot of thought into what they put in their face,
Mm-hmm.
in terms of cosmetics, but sometimes in terms of kind of lubricant products, sometimes people almost will grab the first thing they see on the shelf in the store. So I think it's really important to highlight that EZ Magic Wand, a bit like you said, is medical grade glass. It's non-porous, so it's very, very different from the other products that are out there. And the AlloGlide, the irregular, they're very, very well kind of designed and manufactured, and they're also designed for people who are symptomatic, also whose tissues are a bit more fragile, who are a bit more sensitive. So I think women in particular need to really almost put more value on themselves, what they're using.
Yeah, like the AlloGlide, for instance, is a U.S. FDA approved medical device, actually, and the Relivium is a U.S. FDA approved over-the-counter drug. So both of those have both been FDA approved. And so we have some great questions, Gerard. So I thought we might go into answering some questions that people have, if you don't mind.
Perfect.
All right, so Melissa has another great question. She says she has an issue with the interstitial cystitis belly. Will pelvic floor therapy help with that? I swell in the abdominal area just with movement. So is that my pelvic floor?
Yeah, so that's probably getting into another kind of type of pelvic pain, which now has come, it kind of comes under the umbrella of kind of bladder pain syndrome. So that's where you're getting maybe a lot of kind of bladder symptoms, abdominal symptoms. So pelvic health physiotherapy can do lots for that also. And what that involves is probably some pelvic floor work, definitely, a lot of abdominal work, and then also looking at kind of bladder health, kind of bladder retraining. Also look at bladder health in terms of fluid intake and type, bladder sensitivities. Also looking at bowel health, and also getting into the realms of kind of diet as well. So that is quite a common condition that a pelvic health specialist will see.
Perfect. And just to clarify for everybody, different types of short terminology. Here in the US, it's called interstitial cystitis, but over in Europe and in the UK, they more commonly refer to it as bladder pain syndrome. There are a few people out there that will call it painful bladder syndrome, but that's the standard nomenclature over there. So all the exact same thing, just different nomenclatures in different areas. So. And then Crystal here has, I think this will be a great question for you, Gerard. So as a male practitioner who treats pelvic pain, what advice can you offer to husbands of your female patients? My husband has no frame of reference and struggles to support me in my healing journey.
Yeah, so that is a very, very good question. I think what is important is that over time, that partner, or in this case husband, that they also start to learn more about this, so that they start to understand, what's causing some of the symptoms, where that pain is coming from, how it affects bladder, bowel, how it affects intimacy, how stress and anxiety affect the symptoms. So I think in terms of the uh, the partner, I think what what specialist PTs are good at is helping to start that education process and involving the partner, as long as that uh, woman is happy for them to do so. And I think also you tend to build quite a strong rapport with these patients. And then what's then also quite common at some point is that some of those women will maybe bring their partner to an appointment. In this case, their husband. And also we see that with the men, that some of them will bring their partner also. So I think it's really important that, because for a lot of women, especially if they're in a relationship, pelvic pain is a couple's condition.
Yeah.
Because it and what you sometimes, or what we spend a good bit of time doing is we will kind of find out, are they in a relationship, or who's at home, or who else is important in their life. And we will also ask them, well, what does your partner understand about this? And a lot of the time, that is a big source of that driver of stress, because it may be that they don't understand too much. These are complex conditions. So I think involving the partner or husband is really important.
Okay.
And it can also then move to a level, and this is also quite common, in that you might involve the partner in doing some of the treatment with whether it's a male or female pelvic pain patient. So that may start off something very kind of gentle, like doing some of that abdominal massage.
Mm.
So what we would do is we would have both of them in clinic, or maybe online, and we would show them how to do that abdominal massage, and then we would get them to go off doing that. And then sometimes you might then progress that, if they're using one of Ileana's EZ Magics, that their partner would start to get involved in doing that kind of very gentle internal mobility work. I think at some point, to be really successful at treating this, that partner needs to be on board. Now that's not always easy. I'm relationships are complex. I had a male patient last week, a new patient, and he had quite a lot of pelvic pain, but he had a lot of secondary erectile dysfunction because of that pelvic pain. And he found intimacy quite difficult with his wife, because he was having some erectile dysfunction, and they were trying for a child, but sexual activity was becoming very difficult and very, very stressful. But he never really he hadn't told his wife that he had these problems, so she felt that the issue was probably with her. And one of the big things I said to him, which I've said a few times, is that at some point he needs to have this discussion with his wife, that he does have a specific problem.
Mm-hmm.
So I think involving the partners, as long as that's a safe, consenting thing with the patient, that's a big step forwards.
I think that's a great, because they're so the intimacy is such an important part of a relationship. So and that's what so many pelvic pain patients want to get back to. So I think that involving your partner is an amazing idea in your health, because we don't always think about that. Definitely. So we got a couple more questions here. Is there an exercise that you might be able to tell them separate of doing a telehealth visit for urgency or frequency?
Yeah, so with frequency, excuse me. So with frequency, what you sometimes will work through is doing some bladder retraining. And that's sometimes these patients who, they may be having to go to the restroom, maybe, or I suppose you don't call it the restroom at home, do you? No?
No, yeah, we do. Yep.
Oh, you do? All right. I thought the restrooms maybe
Oh,
when
we
you were
got it.
out.
I was
So
expecting
you go to
more.
the restroom. So this is men and women who are going to the restroom. Frequency is kind of, the definition is about more than 7 or 8 times a day. But these are people who are maybe going every hour, every 45 minutes. So they're voiding frequently, not a lot of volume. And they may also be getting nocturia, where they're up several times at night. So basically, these are the people who present to the clinic whose life is being dominated by going to the restroom. So they will struggle on long car journeys. They'll struggle on going out for the day. They will they'll have a lot of anxiety around toileting. They're the people who struggle in long meetings. And if anything, that's a lot worse during lockdown, because those people are at home and the restroom is next to them. So a lot of the time they will go just in case. It's kind of called jicking. So what we do with those is, it's good to get some type of baseline as to what's going on. What's the fluid intake? So in terms of volume, and also what are they drinking? So are they drinking lots of coffee, lots of tea? Tea is more maybe an English thing. We drink lots of tea. Lots of coffee, lots of carbonated drinks, lots of Coke, energy drinks, alcohol. So you kind of get a baseline. So you maybe say to them, on your smartphone, just for maybe a week or so, just kind of have casually jot down what you drink. You don't want them to get obsessive about it, because that drives the anxiety. And then initially maybe how many times they're voiding. I don't get them to measure initially, because that's quite invasive. You kind of move to that if things aren't improving. And then you get them doing strategies like, you explain that kind of that pressure system within the bladder, that's become a little bit distorted because they're voiding a lot. So that they need to kind of regain control of that by a little bit of strategies of delaying urination for 5-10 minutes. So really spreading those gaps out a bit between voiding, doing some distraction techniques, bit of breathing, bit of toe tapping, heel raising is good, because the nerves that supply the calf and foot supply the bladder, so it kind of tricks the bladder in a way. Things like someone gets to the office, like post COVID, they're back in the office. So rather than reaching the office, running to the loo, they maybe get to the office, they hang their coat up, they turn the computer on, they do a few emails. Or someone gets home, rather than going straight to the loo, they maybe exchange some pleasantries with their people they live with, or they might check that the dog is still alive, check the cats are still alive, do something, little bit of distraction. So you're trying to almost regain control of that bladder, as opposed to it controlling you. But great question.
All right. And then I have a couple of questions. Miss Illy has joined us, and she wanted to have you point out, how long and how much pressure do you suggest when using Easy Magic? And do you have your patients use the Easy Magic externally as well?
Yeah, so really nice to hear. Really nice to hear from you. And so those are two good questions. I think there's a lot of myths out there about doing anything internally. That there is a myth or this misbelief that it's got to be uncomfortable, or it's got to be lots of pressure, or there is a myth or kind of that it's got that you're trying to chase these painful points. But that's not really the reality of what we do, or that's not the reality of what the patient should be doing. So the emphasis is on very gentle, comfortable, soft pressure. It shouldn't be painful. You're not trying to chase the pain. And I would get people to look at this as trying to get a little bit of mobility into those tissues, a little bit of desensitization, and it shouldn't be provocative. It shouldn't be painful. Because I think that's sometimes something that puts maybe some patients off pelvic health physiotherapy, because there is this misconception that it's going to be painful, it's going to be a lot of pressure, it's going to be a lot of internal work, and the internal work is just one component. There is lots more involved with it. And yeah, it's a really good device. So we do a lot of abdominal soft tissue work. We teach the patients how to do that abdominal soft tissue work. That's kind of relaxing that abdomen, the EZ Magic, especially the larger end, which you can probably show there, it's really well designed for doing that very gentle soft tissue work, especially around that abdomen, especially around the hip. And I think that will highlight to people that although the pelvic floor is important, it's only one component. There's also the abdominal component, hips, lumbar spine. So there's lots more also, but yeah, using that externally is very good.
And if you do purchase from Desert Harvest right now, any of the Easy Magic wands, we are also providing a guidebook from Amy Stein that you had mentioned before, and from New York City, a pelvic health specialist from New York City, and then also some guidance from the Pelvic Health Center here in North Carolina at Duke University as well. So we're providing a little bit of information. We'll have to get some from you, Gerard, and set it in there too.
Thank you.
Yeah, definitely. So, well, thank you so much for joining us today, Gerard. This has been very informative. If you are interested, anyone out there, in purchasing any of the products that Gerard mentioned, you can do so on our website. We've got it scrolling down there, but it's the www.desertharvest.com. And if you'd like to schedule a telehealth visit with Gerard or his team, or to learn more about his practice, his website is below, which is the harbornphysio.co.uk, and as well as I put his Instagram up there, so that if you want to reach out and converse with Gerard, you can do that. So thank you again very much for joining us, Gerard, and thank you everybody else for the great questions. Thank you.
Yeah, thank you very much, and I hope big thanks to Heather for the invite. It's a real honor to do this. It's my first Facebook Live, so it's been a really good experience, and also I hope everyone stays safe and well during COVID-19. I know it's a tough time for people, and just to re-emphasize that, PT for pelvic pain at home is a good thing to do. Pelvic pain is common but should never be seen as being normal, and whether you're male, female with pelvic pain, prioritize yourself.
Thank you, Gerard. Everyone take care.
Brilliant. Thank you very much. Thank you.